Hi everyone, Abdul Mananir. I'm a GP in Haslingden. I thought I'd just talk to you about the news headlines regarding AstraZeneca vaccine, which I'm sure those of you who followed the news media today and over the last couple of days, we've been hearing about some hesitation and concerns with regards to the AstraZeneca COVID-19 vaccine that we've been using in a big way in the UK over the last few months. As you might have heard, Ireland, Netherlands and a few other countries, mainly in Europe, have expressed concerns that the AstraZeneca vaccine might be linked to blood clots in the body. For example, clots in the legs, clots in the lungs, as a result of which they are not stopping but kind of slowing down or temporarily suspending the use of the vaccine in some of those countries. Now, let's put all this into context and let's be objective about it all. As things stand, folks, having looked at all the data, the reporting that we have done in the UK, and remember, the use of AstraZeneca vaccine has been probably the biggest in terms of numbers throughout the UK, because our vaccine programme has been well ahead in comparison to other countries, especially Europe. The use of AstraZeneca vaccines has been over 17 million doses as things stand. And when you look at the data that we have so far, the vast majority of people have been absolutely fine, and we're talking almost everybody. Of course, we've come across symptoms like aching arms and temperature and feeling a bit unwell over the first day or two. Perhaps, that's quite a common thing you might come across with any vaccine, really. So I'm not talking about these kind of symptoms, but nothing significant that one would be concerned about. Well, certainly I haven't come across in my own experience, having been involved in thousands of vaccination across the locality that I work in Rossendale. And colleagues and friends who've been working in the vaccine programme throughout the UK have also been quite happy with the outcome so far. And the fact is, it has already been reducing hospital admissions. It has already been reducing the severity of illness, where people have gone on to develop COVID-19 after having had the first dose of vaccine. So those are the facts, that people are actually, in the main, they're fine, having had the vaccine. And also, they are reaping the rewards of lower rates of hospitalisation, low rates of severe disease, and very importantly, we're seeing that death rates are coming down in a massive way, to such an extent that the government's plan to normalise how we live and interact in society, things are going to, the lockdown situation will be eased as planned over the next few weeks and months. So I'd just like to, I guess, reassure yourselves and say that, look, whilst every country has a right to question and look at data and so forth, as far as things are concerned in the UK, we have very little concerns in regards to the AstraZeneca vaccine. The data confirms that. And regarding blood clots, actually a very important point, the rates of clots that we've come across in the UK, and again abroad in those very countries, they're no different to what you'd come across in normal times, vaccine or not. You're going to have an X number of people who experience blood clots, statistically. So and a certain number of people will get blood clots whether they had a vaccine or not. That's a fact of life. And we have enough data to show us that actually vaccination has not empirically increased the rates of clots and conditions like that in the UK or abroad. Look after yourselves and see you around. Take care. Bye-bye.